Because of several factors, the audio on the first half of Marcia's presentation is unusable, so I will be dubbing in the audio content until the point in the lecture where Marcia's voice comes through. Thank you for your understanding. Marcia Poe is a dental hygienist with a master's degree in nutrition. She teaches at a college level and practices in a dental clinic. Her experience has taught her that there is a strong mouth-body connection. It has taught her that many patients are completely unaware of the massive amount of sugar they are eating and unaware of the harm it is doing. She understands the implications various meds have on our well-being and how so many people do not understand this. There is an excellent handout on the drugs and the interactions to nutrition in the lecture notes. The concept of the mouth-body connection has been around for a long time. Our Surgeon General put out this statement in the late 90s. The terms oral health and general health should not be interpreted as separate entities. Oral health is integral to general health. Oral health means more than healthy teeth, and that you cannot be healthy without oral health. We are in the front lines. Dentists are the primary care providers and are uniquely positioned to play an expanded role in the detection, early recognition, and management of a wide range of complex oral and general diseases and conditions. I inherited soft teeth. That's why I have so many cavities. I'm sure it has nothing to do with the junk food and the no brushing and flossing. Over the years, dentistry's progress has occurred biochemically. We've gone from plaque to biofilm, from just caries to remineralization, and from microbes and terrain to host response and biochemical individuality, as well as from the mouth and teeth only to the paradigm of the mouth-body connection. It is a two-way street, and there are certain conditions of the body that affect the mouth, but there are also conditions of the mouth that affect the body. Oral health is indivisible from total health. Oral cells and fluids are used as a diagnostic tool. The mouth is the portal of entry for infections that can affect local tissues and may spread to other parts of the body. Adversely affected by many medications and other therapies commonly used in treating systemic conditions, one has to be always aware of what people are taking for their medication. So you think seeing a dental hygienist regularly for my periodontal disease could help me get off the insulin? Well, of course not quite, but it is an important piece of the puzzle. The body marvelous. And one of the largest organs and one responsible for getting rid of a lot of toxins is the skin. If we could take the skin off of our patient, then we could see what's underneath, and it would give us many clues about what's going on in the body. This isn't possible, but it would also make our injections a lot easier. Those pesky patients sure have a lot of nerve. Well, this is true, and we have all had a patient that will be one that says, don't tip me back all the way because I get dizzy, but they want you to check the very back of the back molar. And these kinds of patients come into our clinic all of the time. There is no such thing as an ideal patient, and we all do our best to try and understand their problems. And we all have to also look after ourselves. The body is a very, very intense and complex machine. And if you have one of those days where you have patients that give you troubles and you don't have very good access, then the first thing that goes is the old back. So it's just important for your own selves to look at your own structure as well and look after it, because patients do put a lot of stress on us. Dentistry's most important tool is the hands. There's a beautiful picture of the circulatory system of the hands. If you have a chance, you must go and see the body exhibit. It's at the Tropicana in Vegas, and it's just marvelous, the work that these people have done to show you the structure. Here we see an excellent example of both the skeletal system and the muscular system. Here's a wonderful dissection of the organs. This cross-section shows how fat tissue can surround all of our vital organs, protecting it and keeping them healthy. This is a healthy lung and a healthy heart. This slide shows the devastating effect of smoking on both the lungs and the heart. The teeth and nutrition. Caries is an ever-evolving subject, and we know that nutrition has a huge impact on the development of caries. Marcia's thesis was on fluorosis. She used to be a strong supporter of fluoride, but now after researching the subject, she is strongly opposed. If you see a patient that you suspect is suffering from bulimia, it is your obligation to address this issue, especially if the patient is a minor. Of course, perio is another disease that is nutritionally linked. The mouth can also provide many clues to various problems and deficiencies. Here's the classic example of iron deficiency with the pink, shiny tongue on the right-hand side. Focusing closely on caries, caries can be attacked in many ways and treated, first of all, by considering that both sugar and bugs are our problems. We have the ability to remineralize. There are lots of medicaments and helpful items commercially available. We also want to look at the pH of the saliva. We have to stop drinking pop, and we should also consider an alkalizing diet. Looks like you have a large food trap here. That is what my family practice doc told me too. Just one more note on bulimia. Once again, if you suspect anybody with bulimia, it is your obligation to notify the proper people. Make sure you get testing because it can be an extremely devastating disease. Here's a couple of examples of mild and moderate fluorosis. And here is severe fluorosis. There's still many docs out there that would explain away these markings on the teeth because of a fever. In fact, there's many docs don't realize that the fluorosis even exists and that fluoride is the offending toxic agent. We'll go through some of the nutritional deficiencies. Of course, vitamin A deficiency will create both dry skin and hair, blights, spots, and poor night vision, as well as anemias. The vitamin A deficiency can cause blindness, dry eye, and the Bitot spots. These spots are characterized by the silvery flakes on the outside corner of the eye. Bone is essential for good dental and general health and relies on not only calcium but the other components listed, as well, of course, vitamin D. A good bony health will give us as well a good skeletal system and good dental health. The trabecular bone around the periodontal complex is as prone to the osteoporotic lesions as other bones in our body. Vitamin D deficiency has become almost epidemic. Much of the problem has to do with the fear of the sun. We don't spend much time in the sun. We need 20 minutes a day. As well, our busy lives keep us out of the essential sun rays that keep our body healthy and allow vitamin D to be restored. Vitamin B deficiency, you get typical angular chelosis, the pitting edema, which the old folks tend to suffer from. Vitamin C has the petechiae and the scurvy. Thiamine deficiency will include these problems. I'm pretty sure she has a terrible case of burning mouth syndrome. On the left, you see a glossitis associated with a thiamine deficiency, and on the right, you see the typical angular cheilitis. Given vitamin Bs, both of these things can repair very nicely. Pellagra or niacin deficiency can be characterized by the symptoms listed. The patient that's pictured on the left actually shows the sequential improvement of his condition with the administration of niacin. B12 deficiencies, we get pernicious anemia, glossitis, the tongue is red, shiny, and sore, as well as we get angular cheilitis. Scurvy has become less common. However, there still are cases, and if you suspect a scurvy patient, testing should be done to confirm or deny the situation. We have to always consider drug-nutrient interaction, especially how it affects the vitamins. Drugs can cause the following problems, and special consideration should be taken with birth control pills, statins, epileptic drugs, and antidepressants. Fosamax is on everybody's radar, and the problems with it are well documented. In this slide, we see in the top left a characteristic gum tissue that is pale that may be due to anemia. The plate on the right shows an uncontrolled diabetic patient. On the bottom right, we have a bad case of oral candidiasis, and on the bottom left, there is a typical case of dilatant hyperplasia. When you look at patients and you see certain conditions, it gives you clues and may prompt you to have the patient get tested to confirm some of the systemic problems. We're going to talk about tongues now, but not this one. This is a famous tongue, but we're not going to talk about this one either. Nor are we going to talk about this cute little curly tongue, or these two guys' tongues, which are very similar, strikingly similar. This guy is a brilliant fellow, but we're not going to talk about his tongue either. What we want to see in our practice is a tongue that looks like this. This is a perfectly shaped, nicely colored tongue, and is a picture of health. I think the impression tray is stuck on your tongue ring. The tongue's condition can change drastically with the change in the systemic problems that people might have. And now with tongue piercings, we are faced with another problem that we have to deal with in the office. The oral cavity is our territory, the beginning of the GI tract and the portal for all of our nutrients to enter the body. Whenever someone talks about the tongue and tongue health and the appearance of the tongue, you have to go back to traditional Chinese medicine. These people paid close attention to the tongue and its characteristics and predicted the problems systemically that people were suffering from. Traditional Chinese medicine understands there is a qi or a life force. Too little or too much can be a problem, and the balance between the yin and the yang is very important. The yin has all of the characteristics on the left side, and the yang has the characteristics on the right side. Ayurvedic medicine, developed by the Indians, is another type of traditional medicine. One thing that is very interesting is they have some very similar thought processes with the traditional Chinese medicine. They both observe by looking, listening, and smelling, and using all of their senses to understand the patient. As well, they both understand that disease is caused by a blockage of flow of energy. This slide shows us a map of the tongue and the relationship of different areas of the tongue to organs. In tongue analysis, many characteristics have to be considered: the vitality, the movement, color, shape, moisture, coating, markings, and veins. When considering the vitality, you have to understand whether it's spirited or limp, or if it's a deviated tongue. If you have a deviated tongue, then you can suspect possibly the patient has suffered from a stroke or a transient ischemic attack. Sometimes the patient doesn't even know that they've suffered this problem. The direction that the tongue deviates from will tell you what side the patient has suffered a problem. When considering tongue movements, the tongue movements relate to brain activity. If they're fluid, smooth, or normal, rigid, stiff, coordination impaired, but blocked by nerve transmission. If it trembles, it could be a sign that there's a problem with hyperactivity or exhausted adrenals. Recently, Marcia had a patient that appeared to be very debilitated when she came into the office, and upon examination, the tongue revealed that there was an extremely cracked and quivering tongue, and the patient required a tremendous amount of support to make a comeback in her health.
The body color of the tongue reflects the fluids in the blood, the body's heat and cold. Of course, we want it pink and healthy. If it's dark red, depending on where it is, but it shows inflammation. If it's at the tip, the heart, is probably affected, or it could even be dehydration, which we see a lot. If the edges are red, suspect liver and heavy metals. If the tongue is pale, suspect those anemias or poor circulation. The Chinese would say a cold situation. If it's more blue, that's blood stasis, stagnant blood, but also check out exposure to pesticides, inks, and plastics. Again, we want that nice pink, healthy looking tongue. And here's a darker red tongue showing possible heavy metals, liver, heart, or circulation blockages. Again, the heart is at the tip. If it's red, if it's got a crease in it, if it's extra long, like that kiss picture, suspect some heart issues. And you don't want to scare the patient and go, oh! If you catch yourself going, oh! Go, oh, how beautiful. You want to leave them with a positive message and empower them. You don't want to scare them. But you might start asking about heart issues in their family. Bring a subject up that way. Of course, the pale tongue, fatigue, poor circulation, anemia. These people are usually prone to being overweight, probably eating a lot of sugar and white flour products. That blue cast, again, the pesticides, that blue is kind of subtle. You have to kind of see it on the surface. That's a little harder to detect. The shape of the tongue reflects the quality of the qi, or the energy, and the blood. The small, thin tongue, you look at the relationship of the tongue to the person. So the smaller, thinner tongue would be a weaker constitution, thin and flat, poor circulation. The swollen tongue, fluid accumulation, sluggish immune system, thyroid, pituitary issues. And then the hammer tongue, where it's actually fatter on the front of it and narrow on the back, could be hormone depletion or kidney issues. Here we have that smaller tongue, weaker constitution generally. The thin, flat, cardiovascular, weak digestion. That swollen tongue, start looking at possible thyroid issues, hypoglycemia. This is one that's so swollen that you see teeth marks, okay? They may be holding water because they're dehydrated and the body's not going to let go of any. But also it could be kidney problems, blood sugar handling, hypoglycemia. If you see this with the tooth indentations, ask if when they urinate, look and see if they have bubbles. And if those bubbles don't break within 3 seconds, you might start checking out hypoglycemia and protein digestion. Okay. The moisture should be slightly moist, reflecting the body's fluids. If it's wet, damp condition of the body, fluids accumulating, always look at the spleen and kidney. If it's dry, then you suspect more extreme heat, dehydration. The smokers are known for a drier mouth and, of course, different medications. So here's a drier tongue, and if it's yellowish, start looking at liver issues as well. We'll see some others on that. The coating should be like a light white, rooted, doesn't wipe off, and over the entire tongue. That's the energy is still there. The colors could be a variety of issues. So greenish, if it's a greenish cast, that's a clue. It isn't definitive, of course, but suspect heavy metals. Bluish could be the pesticides, plastics, inks, but also copper poisoning. Blackish, look at serious liver, kidney issues. Dark brown, again, liver, internal heat, dehydration, and antibiotic use. Here's a yellow-coated tongue. This would be looking at liver, it does have some other signs of digestive issues. So the yellow coating is usually further back and tapers towards the front. Internal heat, hyperactivity. If it's really thick yellow coating, start suspecting gastritis or stomach ulcers. Fermenting of foods in the stomach and need for maybe some digestive enzymes or hydrochloric acids as well. Here's some coatings here, some yellow coated. You see these all the time, but when you start asking and thinking about it, it might open up some discussion. Very thick coating, possible respiratory congestion and phlegm, and you also have to rule out candida overgrowth as well. The whiter but heavier than normal, dampness in the body, sluggish, fatigue, edema, full of aches and pains, and respiratory issues. So scraping the tongue, this brings up scraping the tongue. So you tell the patients that you don't want them to brush the tongue. That pushes things down deeper into that shag carpet of the tongue. And scraping first thing in the morning will actually clear up a lot of their respiratory issues, especially that sinus patient like, don't tip me back, I got the sinus drainage, you know? You know that patient. Black coating, serious liver or kidney issues. The further back would be more indicator of kidney problems. And also rule out antibiotics being taken recently. Got to get them on those probiotics if they're going to do antibiotics. That's that green coating. It's really subtle, but if you start looking, you might see some of these things. And just another clue, start checking further for heavy metal toxicity. No coating, that's not any better. That's possible protein deficiency, lack of fluids, so dehydration, cold situation, liver and kidney issues. Glossy without any coating, look at iron deficiency or B12 deficiency. Possibly also malabsorption. If you're malabsorbing, you're not absorbing those nutrients. The pH of the system plays a big part in that, because if you don't have your pH right, you can take all the nutrients and not get them assimilated. We are what we eat, but really what we assimilate and don't eliminate. If we not eliminating, we're accumulating. Tongue cracking, the location of those cracks, you look at that map and you can see how that is affected by the different organs. So the depth of the crack signifies the severity. So it's shallow, not as bad as a deeper crack that's more severe. Also look at the B complex vitamins. If it's in the center, depends on exactly where in the center. If it's the middle to the back, suspect kidney. If it's right in the middle, GI, stomach. If it comes all the way to the tip, then that's a heart indicator. Along the edges, cracking, liver, gallbladder. And between the center and edges, the lung. So we'll see that. You go, oh, how beautiful. And you've seen these tongues all the time, I'm sure. So the deeper, more serious, lower vitality and weakness of the constitution. So center crack in the middle, you see this probably the most, because people are eating too fast, drinking too much fluids with their meals, probably need digestive enzymes, and also eating too many cooked foods, not enough raw foods, because we're killing off all the enzymes with heat that's naturally in the food, and our body has to do it all on its own. So more raw foods would be advised. Center crack with these side cracks. This is assimilation issues. So you see those cracks there from the center to the side. They call those spleen cracks. But assimilation, you start again with digestive enzymes and getting down to the cause of that. Center crack to the front, that would be heart. Along the sides would be liver gallbladder. And if they're mercury toxic, they're probably going to have some effects to the liver. Now this is liver where along the edges they're paler, it's almost shinier, and it's sometimes rolled. Not always, but it kind of rolls up. I was watching a movie the other day, and it was a Chinese travel thing, and they went to a Chinese doctor, and I could see in the movie, oh, that guy's got liver issues, you know? So you'll start seeing these things and being able to relate to it when you do, so. This is that lung crack I was telling you about. Of course, the one on the right is deeper, more obvious. So sometimes you gotta kind of pull the tongue apart a little bit, and they may not be a smoker, but I've had patients say, well, I get bronchitis every winter and usually end up with pneumonia every year. So they have a weakened respiratory system, and they're prone to that, but that's another clue for you. Spots and marking, red spots on the tongue, hormonal imbalance, excess estrogen from all those xenoestrogens, and also prostate issues if it's towards the back. Okay. This is what I'm talking about with red spots. It looks like little measles. But I actually see this a lot in teenagers, especially seems like the boys. They're going through that hormonal change. So this may not be disease state, it could just be a natural effect of those changes of hormones, but also ask and rule out that they've had mono or some other issue, some underlying infection. Okay. Okay, and this is red tip tongue. This is that heart. You see this a lot in healthcare workers because they're really stressed, they're really trying to do a good job, they work hard, they don't get enough sleep, and we really are burning the candles at both ends. This is showing possible prostate issues where you got the spots towards the back. Geographic tongue could mean allergies, respiratory problems, sinus, possible parasites, and if it's cracked, more digestive issues and even iron deficiency anemia. And we've all seen some of this geographic tongue. I'd really start looking at some B vitamins and possible allergies, and it could be from toothpaste, mouthwashes, and other things. So always ask further. And in our office, we try and get them off the regular store brands into better choices like the tooth and gum or the xylitol spray products. Underside of the tongue. There's two veins under the tongue, and this relates to the liver meridian. And ideally, you don't even see them, or they're just very light. The darker red or blue or purple, more pronounced, again, more severe. So this would be normal. And here we see it slightly protruding, but you want to catch that right when they first do it, because if they keep going, it'll bring more blood to that area and it'll kind of skew your observation. So if it starts forking, that's more likely a liver issue, and especially heavy metals. So we can see a lot of tongues like this, okay, when it starts branching. A lot of purple spots along the side of tongues also. And when it's almost like a varicose vein, you can probably consider that you have circulatory issues or poor oxygen levels. Okay. Also petechiae in the mouth, little red spots could be a sign of vitamin C deficiency. I used to see smokers with the little red spots on their palate. I don't see many pipe smokers. Don't see many pipe smokers at all anymore, so that would just be kind of a localized effect. And of course we know about amalgam tattoos and all. This is very interesting. You pull up the lip and look at the frenum. Ideally, this should look like this, but if it has a little cyst tag, like a little skin tag, if it's towards the lip itself, that's possibility of being prone to polyps, but that's the small intestine. If it's near the gum, it's more likely the large intestine. And if it's right in the middle, it might be the ileocecal valve, kind of where the small intestine connects to the large intestine. Are we about out of time? I'm lost on time here. We're gonna, and of course the heavy metals with the retrograde fillings are pretty obvious to us all, but we have a tongue charts in every room, and I've got some of these off the internet. I bought some in bulk. I brought some. We can save shipping if that you're interested. But we keep one in each op, and when we see some of these things, we bring it out, and it starts that discussion, and the patients are just like, wow, they just didn't even realize there was that many different types of tongues. So this is a patient ed thing that we like to have around. Okay, so with scanners, and we have digital x-rays, so we have computers in every room, we ought to just scan that tongue at the end of our appointment, and then we can check back. But I do write some notes in the chart because the tongue will change. It's kind of the acute symptoms. The eye, it would be more genetic factors, and the nails, more chronic issues. But the tongue can change in just a short time if they're making changes. I don't think we have time to go into nails. We'll have to save that for another time. But if you look at their moons, if they have a red area, there's fungus there. I don't know how to go backwards, I'm afraid. Oh yeah, I do. Well, anyway, if they have a nice moon but red towards the end of the finger, that's a sign of mercury or heavy metal toxicity. We'll go through these nails here. The face shows some things just like fetal alcohol syndromes. This is the nose showing heart issues, the redder nose, and especially if there's a cleft. Kidney issues, edema under the eyes. We don't have time to go into all that, but mercury rising, amalgam tattoos, that red part on the nails. And they tell me, I haven't seen this, but if you look at the eye really close, mercury toxic eye may have a pink ring around the pupil. Looking also under the tongue for that veining and any darkness in the gums and vestibule. So you need a couple of old amalgam fillings with big cracks in them that we need to watch. But watch, withhold reaction until the client hurts, is what that's saying. And now let me get this straight. You carry amalgam all day long, but it isn't hazardous until it's in the sink drain, right? I love these cartoons. And so what do you do that the amalgam has solidified in the carrier? Supposedly, I cannot have it ethically removed until the margins have deteriorated extensively, unless I'm willing to beg for more cosmetic-looking filling. I'm hoping enough was broken off that I can go into full disability. Let me know if you find a doc who will sign off. I still can't get mine for mercury poisoning. The ADA lobby is just too strong. We have smart practice to thank for those cartoons. So remember, nutrition is the floss for your general health. There's some references there, and if you didn't get a handout, let me know and we'll get you some.
You want to read that too, Marcia? You could just finish.
Oh, okay. Disclaimer, I do not have a financial interest in the product. I bought these in bulk. You say I make $2. So anyway, that's my disclaimer. but I brought them so you could have. Okay, yeah, they cost $20.